Hi everybody, my name is Dr. Jim. I'm here with one of my former patients to talk about stem cells for the low back. Thank you very much for coming today, I really appreciate it.
You're welcome.
I'm not going to identify you by name, just a former patient.
Okay.
The first question I want to ask you was, tell me a little bit about your back pain. Before you had the stem cell on your low back, what happened to you? What did you go through?
I got hurt when I was younger, working out, and I wasn't in. I had a disc, part of it cut, but off. And
You had surgery on your back?
Yeah, I had surgery.
How long ago was that?
96.
And after you had your surgery, what did you go through? What kind of treatments did you get? What kind of pain did you have?
I didn't have after the surgery. It was okay, but it wasn't the way it was before, and I have a throbbing in my back, and I would still do my normal activities. I wouldn't do heavy squats anymore.
I want to ask you very controversial questions about your work, but what kind of work do you do?
I work for the Houston Fire Department.
Okay, very demanding, right, physically?
Yeah.
So what made you decide to get stem cell injections on your lumbar spine?
Just to make my spine as strong as possible. I can.
How did you find out about stem cells for your
Just through the NFL football players, they get it, and I thought, hey, if they get it, I'm going to get it. Plus, I had an injury on my Achilles, and I thought, you know what, I got that, and the injection in my Achilles totally fixed it, where I was back to running again, and I could do. So I thought, if that worked, I'm going to go ahead and go with the stem cell.
So you had a PRP procedure, from what you told me earlier, in your ankle, which are similar procedures, not quite the same as a stem cell procedure.
They still take blood out of my arm, and they put it through a machine, and then they shot at my Achilles.
Good explanation, good. So you had the stem cell procedure done. How was that? Was it painful? Did you find it to be uncomfortable in any way? Was it helpful?
Yeah, it was helpful. I went home I took off work about 2 weeks, and I stayed home and just relaxed my back and stretched, and that was pretty much it until I went back to work. And then after I went back to work, I slowly got my life back, started doing my normal things, and I noticed right away that the throbbing that I used to have in my lower back totally disintegrated. I didn't have that anymore.
You said that you ran a lot before. Yeah. How did the running change after the procedure?
Well, before I would run my 3 miles, and then the next day I'd have a little bit of a throb from the run. And now when I run the next day, I can go run if I wanted to 2 days in a row. Before, I wouldn't even consider do 2 days of running. I would split it up.
Would you recommend this procedure to your friends?
Yeah, I would.
Okay. I have a picture that I took 2.5 years ago on your spine, and that was during the procedure. Can I show it to you?
Sure.
I think I showed it to you, but you were a little snowy when I showed it to you.
Okay.
So I'll show it to you right here.
Sure.
Okay. Cameraman, follow us, please. So it's not a really clear picture, but this is the needle that's going in.
Mm-hmm.
And this is your lower back area. This is L5S1, and there's a little bit of dye going in there.
Okay.
And it's right into the disc of L5S1. Now, here's a model. So we did L5S1 level, which is this level. And we went in from the side, we went into the disc of L5. This is where you were having your problem.
Yeah.
This is where you had your surgery 15 years ago. This is where you had your injection about 1.5 years ago.
Mm-hmm.
And you're doing good with it.
Oh, yeah.
At this point.
Totally.
Anything else you want to add?
No, it's good. I feel good.
Thank you for coming today.
You're welcome.
Appreciate it. I'm Dr. Jim. That's what we have to say today about stem cells and your spine.